My name is Stefano Cotrufo and I'm a plastic surgeon in central London, Harley Street. So far in my clinic I performed several hundreds of buttock augmentation by either silicone implants or fat injection. So this video will show you what are the essential steps to follow once you go back home after surgery. Point number 1, the healing time is 6 weeks. You can consider that as a magic number that we use to distinguish the early from the late stage after surgery. Following the first 6 weeks and for a period of about 1 year, there will be a continuous remodeling of the scar. It will be still very important for you to keep yourself under follow-up and keep looking at our recommendations. Point 2, wash your hands all the time. If there is one thing that we learned during the pandemic, is that we tend to touch our face and our nose up to 20 times or more for every minute. And certainly you don't want any of those bacteria around your garments, around your dressing, and certainly not inside your wounds. Point number 3, take your medications after a meal. Most of the medications that are prescribed in hospital afterwards can be very irritating on the gastric mucosa and cause nausea and vomiting during the first days after surgery. Point number 4, keep your garments and dressing on until you're told that you can either have a shower or, in most cases, come back to my clinic and be assisted with your first change of dressing and removal of the garments. Point number 5 is about the sitting protocol. In my clinic, I recommend my patients not to sit at all for 2 weeks, and following that time for another 4 weeks, you'll be allowed to sit on a special pillow which we call the BBL pillow. This sleeping protocol will obviously have an impact also on your sleeping position, so you will be forced to sleep on your tummy for a total of 6 weeks in order to avoid compression of the transplanted area. Point number 6 gives you recommendations on how to go back to your basic activities. After 1 week, you can go back to have your normal shower and you can go back to gym as long as there is a restriction of movement of the hip joint. In particular, I recommend not to squat too low. You will also need to be careful in going back to your sexual activities in order to avoid extra compression on the transplanted area. Last but not least is the protocol to avoid deep vein thrombosis, which means the formation of clots within your larger veins, and that can lead to very severe complications like embolism. Here are the points that are so simple and yet so crucial to follow after surgery. Mobilize as much as you can. There is no need to be resting in bed after your surgery. Drink plenty of water. At least 2 to 3 liters of water are optimal for patients after surgery. Keep your garments on all the time and take them off only when you're going for your first shower, when you're allowed to go for your first shower. Lymphatic drainage massage are a very useful tool in order to reduce the swelling after surgery. In my clinic, I do recommend to have 2 to 3 sessions per week for the first 3 to 4 weeks. These are the essential recommendations to follow in order to heal safely after your surgery, and yet there are so many technicalities that can be crucial in order to A, heal faster and then be safer after your surgery. So if you just had your surgery and you still have some questions, please don't refrain to either call us or email us, and my office will either give you answers over the phone or arrange an earlier follow-up for you to be safe. I'm Dr. Stefano Cotrufo. I'm a specialist in plastic surgery operating in central London. Thank you very much for watching this video. I hope you find it useful. And please don't forget to follow me on Instagram in case you wish to know more about my plastic surgery service, and in particular if you wish to see my results, which of course I'm very proud of.